because if you discover 2024, 2020. But let me just get the number. Get what?
Bob. This Lotus. Which of the following is not a risk for preterm labor? A. Advanced maternal. B. Multiple pregnancies. C. Gestational. D. Normal BMI.
It's like that C was
Gestational sounds odd.
It's like
Normal BMI is actually the answer. But this gestation, I don't know what is gestational.
Normal BMI,
Yes.
body mass index.
Yes, sir.
So they ask what?
Which of the following is not a risk factor for preterm labor?
preterm labor.
Preterm labor.
Please, what is preterm labor?
Labor before the viability. Labor before the gestational age.
What is preterm labor?
Labor which occurs before the woman is at term.
Yes, labor that occurs before 37 weeks or earlier, but it is not below 28 weeks of gestation. We call it preterm labor. Because preterm labor is a labor that occurs at 37 weeks.
A. Gestational diabetes. B. Preeclampsia. A. Gestational diabetes. B. Preeclampsia. C. Postpartum hemorrhage. D. Ectopic pregnancy.
Postpartum hemorrhage.
It should be
Postpartum
hemorrhage. Postpartum hemorrhage. What is postpartum hemorrhage? You know, right?
Yes, sir.
Absolutely.
What is the primary cause of respiratory distress syndrome in preterm infants? A. Maternal syndrome. B. Surfactant deficiency. C. Maternal diabetes. D. Fetal malposition.
What is the answer?
Surfactant
It should be
deficiency.
surfactant deficiency. When a child is unable, because if you look at the breathing pattern of a child, the child will breathe faster. After some time, the child behaves as if he or she is not breathing. It is because of the immaturity of the alveoli to produce the chemical called surfactants. You see this question in continue.
Which term is used to describe a newborn?
Now before you know the answer. What was the answer? It is. So if you are, maybe you are doing ANC, you went for ANC and you discover that a woman is having gestational diabetes, you should suspect that woman for macrosomic baby, a big baby. So macrosoma is large baby of weight greater than 4.5. So what is hypomeresis gravidarum?
Excessive nausea and vomiting.
It is excessive nausea and vomiting. These symptoms is being seen during the first trimester in women. Are we there?
Yes.
Now, if they ask you how can you manage hypomeresis gravidarum, how can you manage it? You can manage it by fluids. You give fluids because the woman has been vomiting. The intravascular space is at a deficit. So you give fluids to correct it. You also give electrolytes to correct it because the woman has vomit. There must be electrolyte abnormalities. Yes?
Which condition is characterized by high blood pressure preeclampsia, ectopic pregnancy, placenta abruption.
Please, the question. Which what?
Condition is characterized by high blood pressure during pregnancy.
High blood pressure during pregnancy, huh?
A. Gestational diabetes. B. Preeclampsia. C. Ectopic pregnancy. D. Placenta abruption.
Okay, so the answer should be pre-eclampsia. Pre-eclampsia is a situation where a woman is a situation which in pregnancy, which is being associated with high blood pressure of about 140 or 90, associated with edema and proteinuria. Then we also have eclampsia. Eclampsia is when the blood pressure is above 150 and above. The woman now will experience what we call seizures. The woman will start to collapse or faint. That one is eclampsia. So if they ask you to differentiate between eclampsia and pre-eclampsia, you should be able to differentiate. Now, the ectopic pregnancy, we know it is a type of pregnancy that develops outside of the uterus, and it is mostly seen in the fallopian tube or the ovidum.
Which of the following is a screening test for Down syndrome during pregnancy? A. Amniocentesis. B. Chorionic villus sampling. C. Maternal serum alpha fetocopenia. D. Non-stress test.
Yes, so which one? It should be amniocentesis. Amniocentesis is being done at which gestational age? It is done at 28 weeks of gestation. Amniocentesis.
What is the most common cause of maternal mortality worldwide? A. Hemorrhage. B. Infection. C. Hypertensive disorder. D. Thromboembolism.
What can be the answer?
Hemorrhage.
It should be hemorrhage. Yes.
Which condition is characterized by the separation of the placenta from the uterine wall? A. Placenta previa. B. Placenta abruption. C. Ectopic pregnancy. D. preterm labor.
What is the answer?
Placenta abruption.
Placenta abruption is the premature separation of the placenta from the deciduum bassalis. Now, what is placenta previa?
Refers to the coverage of the uterus by the placenta.
It is simply the partial or total.
Which of the following is a potential complication of postpartum depression? A. Neonatal sepsis. B. Delayed bonding with the newborn. C. Hyperemesis gravidarum. D. Urinary tract infection.
What can be the answer?
Delayed bonding.
Delay bonding with the newborn. That's why when you give birth, when a woman gives birth, they always try to remove the baby and put on the stomach of that baby. It's because of this.
Which vaccine is recommended during pregnancy to protect against influenza? MMR, measles, mumps, and rubella. A. B. Hepatitis B. C. Tetanus, diphtheria, pertussis. D. Inactivated influenza vaccine.
If you wish.
So hepatitis B vaccine.
Do we give hepatitis B to influenza? Influenza is kata. Influenza is kata common cold. Do we give hepatitis vaccine for that? It should be.
Inactivated influenza
It
vaccine.
should be that.
What is the recommended method of feeding a newborn with milk and palate?
What is a recommended method?
Of feeding for a newborn?
Yes, according to you, what is a recommended method? Do you know what they call cleft palate?
Cannot describe without words.
Cleft palate, do you know? Who knows? Because they are asking what is a favorite method to breastfeed a child with cleft palate. Cleft palate means maybe one of the lips is a hole here. There's a breakage here in which you can even see the teeth. This is what we call cleft palate. Now, somebody that is having an obstruction here, a wound here, which method can you give? Which method of breastfeeding? No. Cup feeding is also good. But now this question, they were supposed to specify, is it unilateral or bilateral cleft palate? What talk of unilateral means it is one side. If it is bi means it is two sides. So if you talk of cup feeding, they will still mark. If you talk of bottle feeding, they will still mark.
Here we have breastfeeding, bottle feeding, nasogastric tube feeding, and cup feeding.
Yes, bottle feeding and cup feeding. But I really go for bottle feeding.
Which sexually transmitted infection can cause blindness in a newborn if transmitted during childbirth?
Is what? These are questions that you are not even supposed to look the answer. Just give me. Tell me. It should be gonorrhea. That's why when you are pregnant and at the level of the trimester, please don't do things that can. Don't go and infect yourself, because the treatment, the trimester means very soon you give birth. And you go and infect yourself. You discover that you cannot treat yourself and the baby will come out with eye problem. The baby will mostly come out with eye problem.
Which condition is characterized by a sudden increase in blood pressure, proteinuria, and edema during pregnancy?
It is?
Preeclampsia.
Okay, let's go.
What is the primary cause of neural tube defect in a newborn?
Yes, this is why you are not supposed to look again the answer. Tell me. Neural tube defect. It is folic acid. That's why when a pregnant woman comes to the hospital, they always prescribe folic acid to prevent neural tube defect. So look if there's folic acid you take. Yes.
Ophthalmic neonatology.
Ophthalmic neonatology. Aha. This now is a situation where maybe you go and contract gonorrhea and you are unable to treat. When the child comes out, will contract ophthalmic neonatology. Read the question very well.
Ophthalmic neonatology. A. Hereditary condition of the newborn. B. Congenital eye disease of the neonate. C. Yellowish eyes. D. Blurred vision.
What is the answer?
Congenital.
It should be congenital. It is not inheritary. It does not inherit it. It is when the woman cannot stay at one position at its later stage of pregnancy, go and contract gonorrhea. You have that. The child, when the child comes out, have that type of
17. Which of the following interventions should be carried out by the nurse when a post-operative patient is in shock?
What are you going to do? A. Read.
A. Remove extra covering on the patient to keep temperature down. B. Place the patient in a flat position in less elevated 45 degrees. C. Do not administer any further medication. D. Place the patient in a
Trendelenburg position.
Trendelenburg or shock.
Can you explain the Trendelenburg position? Trendelenburg means that the patient is sleeping, the head is a little bit down and the legs are up. That's Trendelenburg position. Can we there? The head is down and the legs are up. Means the patient is entering into shock. The little amount of fluid that is found at the level of the extremity will move to sustain the vital organs. That's why you are placing that patient in the Trendelenburg position. Yes. So Trendelenburg position is a shock patient. When somebody is entering into shock, if they ask which position are you supposed to place, it should be the Trendelenburg position. Good. So I continue to bring the ball.
I like to put it there because I saw him putting like the silent.
I think put a name called.
Which of the following is a recommended physical preparation for a patient undergoing surgery? A. Shave the area of the incision with razor. B. Empty the patient with bowel of disease. C. Do not allow the patient to eat or drink anything for 8 to 12 hours before surgery. B. Be sure the patient is well nourished and hydrated.
What is the answer?
Shave the area.
Share the area should be physical preparation. Yes.
Then for this, do not allow the patient to intervene. Does MPO apply with every surgery?
Yes, it applies with every surgery. But let me tell you something. When we talk, there's what we call emergency surgery. In emergency surgery, anesthetic consider that patient as stomach plug. So stomach plug, they are simply telling you that they consider that the patient have eaten. So now the patient will go under general anesthesia. So it is not every case. A case that a patient needs to fast must be elective. It is a planned case. Like for example, they say you'll be operated tomorrow. That's when now they pass and say don't eat for 6 hours. Because you cannot say that an operation comes which is an emergency. You start saying let the person fast. You cannot say it now.
Yes. 19. Which of the following pre-operative medications will be prescribed to decrease pulmonary and oral secretion and prevent laryngospasm?
Yes. Which medication? In the theater, medications that they usually give to reduce secretion, we call it anticholinergics drugs. For example, atropine. So if you see it, then it should be the answer.
Which of the following positions will be used in minimally invasive surgery for the lower abdomen or pelvis?
Yes, which position?
Lithotomy.
Lithotomy, no. It's not lithotomy. Do you know what they call lithotomy position? That's how you usually take it now. That's lithotomy position. Yes. You usually take it for pleasure activities. So the answer should be what? The answer is Trendelenburg, not lithotomy. It's Trendelenburg. It's a minimal now. It's Trendelenburg.
So of the abdomen, when you do surgery of the abdomen,
Read the question again.
Which of the following positions will be used in minimally invasive surgery of the lower abdomen or pelvis?
The lower abdomen or the pelvis. Where are the pelvis? Down. I said lithotomy, the head is a little bit and you walk here. It's Trendelenburg, not lithotomy.
Which of the following?
What is a minimal? If it was a serious something, then it should be